Chief Medical Officer Dr. Sharon belmar-george has provided an update on the public health response to the island's first international flight from the U.S. since the reopening of the borders. The nation's top healthcare official gave assurances of strict adherence to protocols and procedures at the Hewanorra International Airport after the American Airlines flight taxied onto the tarmac and 131 passengers deplaned on Thursday, July 9, 2020. Several of the passengers were tested.
As guided by the established protocol, for all arriving passengers were screened by the health team at the Hewanorra International Airport Public Health Facility before entering the airport terminal. None of the passengers displayed respiratory symptoms nor had fever. A total of 6 PCR tests were done at the airport on arrival, and these travelers were unable to travel into the island with their documented results. Passengers were later filtered to one of the locations established for the quarantine period. Many processes were put in place to ensure the efficient processing of the arriving travelers at the airport health facility.
The air travelers were screened for 90 minutes before leaving the airport bound for quarantine. Moreover, according to the CMO, state agencies conducted a post-mortem to evaluate procedures.
The processing of the 131 passengers of Thursday, July 9th lasted for about an hour and 30 minutes in total. A debriefing meeting was held immediately after the process was complete, and this involved representatives from the Ministry of Health, the St. Lucia Air and Seaport Authority, and representatives of all of the other relevant agencies. This allowed to identify the strengths within the current process flow, as well as to identify areas requiring improvements. These improvements will focus on supporting the smooth flow of the passengers, which includes increased signage, dedicated lines for passengers with different conditions, and the use of a numbering system to provide some order in attending to the travelers and increased number of booths for the processing of health screening.
The Chief Medical Officer continues to urge compliance with established COVID-19 health and safety protocols and guidelines to stave off infection, especially as the island has opened up to commercial air travel.
We continue to advise the public to maintain the recommended public health measures to reduce the risk of transmission of COVID-19 in the event of the importation of cases. We will continue to provide regular updates on the national COVID-19 response to the public.
A total of 1,955 COVID-19 tests have been carried out on island to date. The decision to embark on the pilot phase of the resumption of flights from the epicenter of the global pandemic is mired in controversy. COVID-19 cases continue to skyrocket in the United States, which is the main source market for the mainstay of the St. Lucian economy, tourism. Critics argue that the risk is not worth the reward, given the island's success story with 19 fully recovered COVID-19 cases and 3 patients recuperating. But, with thousands of St. Lucians out of work, supporters argue that securing lives is just as important as protecting livelihoods, particularly with the local economy in tatters. Colby DeVoe, HTS News Force.